Portland's mobile medical outreach is reaching new levels.
The MMO has been around since 2016, but through a recent partnership with MaineHealth, the demographic of unhoused people that they're trying to help is changing. And a lot of that is due to the passion of one doctor who spoke with our Pearl Small.
There was a time that I met a pregnant patient 3 different times in Deering Oaks Park before we were able to get her into a kind of traditional medical setting. And
Dr. Elaine O'Connor has an especially vulnerable patient pool: unhoused, pregnant, or postpartum women struggling with addiction.
you know, society actually particularly stigmatizes pregnant people because people can't imagine how people are doing that when they are pregnant, but it's the same terrible disease that everyone else struggles with. It doesn't get better magically because people are pregnant.
After moving to Portland a few years ago, O'Connor realized accessing those patients wasn't as easy as scheduling visits at her office. Many of them lack trust and fear being judged.
If anything, I think the shame and the guilt and the fear and wondering if they're going to be able to maintain custody of their infant is just that much more.
O'Connor found if she was going to provide them the care they need, she had to make it portable. So she teamed up with the Portland Fire Department to add her services to their mobile medical outreach program.
We describe it as practicing in parallel. So, many of the things that she does are not things that we can do.
EMS workers have been operating the outreach van 5 days a week since 2016. While they're able to provide some medical care to unhoused people, it's limited. Now, with O'Connor joining them a few times a month, that care is expanding.
We can be her eyes and ears and find patients for her that would benefit from her help, and also follow up with her patients. Oftentimes we know where they are.
Together, they're making an impact, which Portland's Public Health Division Director, Bridget Rauscher, says is hard to measure.
I think a lot of prevention work is really hard to see, and that's what a lot of this work really is.
Rauscher helped secure funding for the program, which she believes is actually saving money.
We are going out and finding problems maybe before they are a crisis or an emergency.
What might have been, a 15, 30-day hospitalization ends up being, one night.
Without treatment, pregnant women with substance use disorders are at high risk of delivering early, and their babies often need long-term NICU stays. Dr. O'Connor says the right support team can completely change that outcome.
And we really try to wrap ourselves around them, be with them, be present with them.
O'Connor is now a proud member of that team. In Portland, Pearl Small, News Center, Maine.